Is he? Why you ask? Because anywhere I go, be it cats starting, be it technology, be it you name any symposia, any workshop, anything, he stands up and speaks very fluently and courteously. And one time I went to CAE, and guess what? He is presiding so courteously, so organized, and made things go very good. So I listened in the radio about an ad that says Bob, Bob from accountants. And I came to know the man later on when I made my first study abroad course to Egypt. And he was a big supporter of the program. And it was one of the most successful ones, as I heard from others. Then that helped us to go to China after this. And he would say, Bob, without much ado, here's Bob.
Well, thank you very much. And thank you for coming out this morning. I send my accolades back to the both of you. Abby was instrumental in raising awareness of the importance of study abroad and put down many barriers to ensure that our students would have a chance not only to study in Egypt with someone who spoke the language and the culture, but also be part of the Three Gorges Dam in China, a great engineering feat in our world. And so I was delighted that EIU was a part of that. Dean Lanham, I gave an award 2 years ago now because in spite of the library being in 10 or 15 different places for 3 years, not one student ever didn't find what they needed to complete a thesis, complete a project, complete whatever they needed to do, not once in that period of time. I thought that was quite amazing, and I had a chance recently when I was doing this to kind of re-engage with the library, and I have to congratulate all the people who work here who make being a scholar something that's just a pleasure and enjoyable, and I really admire all of you for all of that. I had opened earlier with, I got this lovely email this morning from a student of mine from 1985, Athens Aphilas. He was from Greece. He came here to get his master's degree in speech-language pathology. He was so excited that the university was focusing on his home country. So sorry he couldn't be here. And he is hugely successful. He is the director of a large craniofacial clinic in Greece, or outside of Athens. And I went there a few years ago to visit with him. Unfortunately, we were not able to connect, but I'm hoping someday that he'll come back to campus and be able to be recognized for his contributions. So this morning, I'm going to talk to you about the beginning of speech pathology. And it all begins, according to legend, according to law, or according to fact, with Demosthenes. And you can see from this great picture of Demosthenes that not only was he a great speaker, but look at that flashy dresser. Look at those sandals. He was setting the stage long before this was really the standard. So I was really impressed with this picture of Demosthenes because I think it's always important to make a good first impression. So I thought we should start off by learning a few things about him so we can start to understand the context in which his sort of gave birth to speech-language pathology. And he had a tough life. While he was born into a very wealthy family, he was orphaned at 7. I could never find the conditions of his, why he was orphaned. I don't know why his family died at that time. And so his father, who was wealthy, put all of his resources into the hands of 3 trusted individuals who betrayed Demosthenes and squandered his money. So when he became of age at 18, he was penniless and not too happy about it. All he had left was his father's estate. All the money, all the investments were gone. So he had a good reason to speak up for himself. Money can be a very driving force in people's lives, and it certainly was for him. And so he began a career at age 20 as a type of a lawyer, suing guardians, Phobos, Demophon, and Euripides. I'm not sure if I've said those correctly, but he sued them, and to his credit, he was able to recover a portion of his father's wealth, and that allowed him to be able to live more independently. In this process, he moved toward becoming a politician and a lawyer. And of course, both of those particular careers are heavily based on your ability to speak, and to speak well. Recently, a big hit in the movies was The King's Speech. Can you imagine being asked to speak in front of hundreds of thousands of people, and you can't speak fluently. Politicians and lawyers, professors are asked to do that all the time. Most people never give their ability to speak fluently or to speak correctly a second thought. But if you can't do it, it's a big deal. He has a very well-known oration called On the Crown, and this particular oration brought down several different governments, and I didn't have a chance to read it myself, but if you were ever interested, that's one of his greatest speeches. So that's a little bit about his background. So what was the issue with him? He had a mentor, like we all had mentors, called Pathology. There was a character called Mumbles, and I always use that as an example of indistinct speech, where someone like this, you can't quite understand what they're saying. Shortness of breath comes back to weakness of voice. Breaking and disjointed sentences. Stuttering is a little like that. It's broken and disjointed, and it calls lots of attention to the speech act itself, and therefore the message is lost. Now, it's more common, as you probably know, to do a W for R substitution and say wabbit for rabbit. And in fact, if you like the Big Bang Theory, there's a character on the Big Bang Theory that has a terrible W for R, W for L substitution. And he does it in a way that makes him very charming, but I guarantee you that if you're someone who's a 30-year-old and trying to present yourself in a public environment, you wouldn't be being able to using a W for R, L substitution. So this substitution is a little unusual. This is a little unusual type of substitution. So these were the characteristics of his speech. I also want to point out this wonderful series of columns, because when I was in Greece at the Parthenon, and I loved the Parthenon, it was this series of columns just behind the Parthenon that I found to be the most beautiful and charming sculptures I've ever seen. Several of them have been name you get. Someone starts calling you a name about that. And in ancient Greece, no different than today in the United States of America, he was referred to as Metalis, which is the name for stammerer in Greece. Cicero, a famous person at the time, said he couldn't say his R. However, later on, there are lots of positives about his speech, and Pericles is a famous. What we would say today, it would bring his speech patterns into the normal range. What does that mean for us? It means now people are attending to your message, not attending to your speech. That's how we characterize that. So he practiced speaking with pebbles in his mouth. He recited verses while running along the shore, speaking over the roar of the ocean. That would increase your breath support, speaking over the roar of the ocean. And he followed a disciplined program, did this every day, of diction, voice, and gesture. So he'd be talking like this, making a point. So he was practicing over and over again with gesture and with a louder voice and this sort of thing. So that's the perspective that we have. Now, was he the only person in history that had a speech disorder back in the day? No! Those of you who read the Bible may know that Moses was often referred to as being slow of tongue. And that's why he said, when he was asked to lead the Israelites out of captivity, what, me, I am slow of tongue. How could I get these people to follow me? And the answer to his treatment, I call it this, his treatment was to have faith. So that was the treatment of the day. Then another Greek historian, Herodotus, stammered and was unintelligible. Now those of you who've been around young children know that many times young children are unintelligible. They can't say all the sounds correctly, and so you often don't know what it is they're talking about. And oftentimes they get very animated when you can't understand them and carry on about it. Well, the treatment was to immigrate to the south of Libya. I don't know what was going on in the south of Libya at that time, if that was the treatment. Could be, and I couldn't find this. Sometimes there are spas or warm springs or other kinds of things like that even today we go to. People go to warm springs or mud baths or things like that for various treatments. So it could be that Libya had something like that, and I just couldn't find it. And finally, this bulbous just keeps coming up. This was a word for a stammerer and a lisperer, and I couldn't find any treatments there. So, that's it. Now, zoom forward. Zoom. There's nothing else from the time of those ancients to the 16th century. There's not much in the literature about what's going on to analyze or treat speech. But when you move forward into this generation, now we start seeing Mercurialis was one of the first people who wrote or chronicled the chronic versus accidental stuttering. And this is true. This is true. Chronic stuttering is the type of stuttering that emerges in childhood and doesn't go away. For those of you who've been around young children, almost every young child goes through a period of what we call normal non-fluency as they learn language. It's a normal situation to be in. But as they become more confident language users, this repeating goes away and fluent, but not all. Those children often grow up to be adult stutterers who struggle to be fluent throughout their lives. In the speech pathology, we've spent a lot of research energy trying to distinguish between children who show normal disfluent patterns and are going to go into fluency from those who are not, and how can we treat that early. Accidental stuttering occurs this way. You fall and hit your head and you wake up disfluent. You can have an accident and become disfluent because there is a neurological underpinning to stuttering. You can have, that's a closed head injury we call that, but you can have a stroke and become disfluent as a result of stroke, or you can take drugs and become disfluent in that way. Anything that might cause neurological damage to your brain can result in what I think is referred to as accidental stuttering. You were fluent, and then at this day, when this thing happened, you're now disfluent. Aj says that the speech problems are caused of organic, we call these organic disorders. He's referring to the structures of your mouth. Your soft palate is, if you don't gag yourself, you took your thumb and you put it in your mouth and you shoved it up, you feel a bony plate right behind your teeth. That's your hard palate. It's attached to a muscle. That's your soft palate back there. You close this palate off when you talk. Well, you don't sound like this. If you don't close it off, you'll sound nasal, because that allows sound to come out your nose. So your soft palate is critical to having a normal resonance pattern. For children who are born with cleft palate, cleft of that palate, or anyone who might have a damaged mouth, you can end up being what we call hypernasal, like that, because that muscle doesn't work. That plays a big role in intelligible speech, a big role. You cannot get the sound to come out orally. You'll really struggle, tongue like that. It's hard to get oral pressure. The uvula is that funny little thing that hangs down off the soft palate. We've studied that ad nauseum for 1,000 years, and we don't believe it has any relationship to speech. And we don't exactly know why it's there. We don't know what the purpose is, even though we've studied it. And the root of the tongue, of course, is a very large muscle, and a lot of people have been concerned about the root of the tongue. Itard said that stammering was a pathology of the larynx and tongue. The larynx is this gizmo, right? For men, if you find your notch, your larynx is right there in your throat. In your larynx are your vocal cords. Vocal cords are extremely delicate muscles. Think of them as little pieces of tissue paper, and they vibrate beautifully, kind of like a butterfly, like this when you talk. And that's how you make tone when you talk. And if you ever want to know how delicate they are, just ask Julie Andrews, the great singer. She had singer's nodules, and you have to really think carefully about surgery on those vocal cords. She chose to have it. She'll never sing like she was able to sing again as a result. They're very delicate, and they don't respond well to infections, and so they're, don't take for granted your ability to produce voice, because it's really something that's easy for you to do until you don't have it anymore. So that's the larynx. And there can be, the more normal pathology of the larynx are two types. Cancer, you may know someone who's had their larynx removed. That means they can't make any vocal tone anymore. So oftentimes they speak with an artificial device called an artificial larynx. It's a buzzer, and they hold it next to their neck, and it creates the tone for them. You can also have your larynx crushed in a car wreck or similar kinds of accidents that can result in poor vocal tone, and there are other things that can happen. Finally, we had defective speech caused by misapplication of breath. So we're back to this breathing business, and breathing is important to speech language. So these were some of the ideas. Combat, metronome. Oh, sometimes devices like this can be very useful, can be very powerful. So this was one of the first treatments that began to show some promise for people who were disfluent. Bloom, breathing and tongue exercises. Oh, this also held some promise. And again, one of the first systematic approaches that began to show some promise. Well, then down here, electricity was coming into use. We had shock treatments for mentally ill. Why not shock that tongue? Let's see if that worked. Didn't work. Not a good idea. And of course, there's always drugs. And so we drugged people and it certainly slowed down their speech. I'm not sure if they did fluent, but certainly slowed it down. So those were some of the early treatments there. Finally, systematically organizing our profession began in Iowa, at the University of Iowa. And it began when the University of Iowa believed that not only should we follow or study observable phenomena like how cells divide or the makeup of particles, we should also study human behavior in this way. And the field of psychology began to emerge there at the University of Iowa. It broke away from the other sciences, the biological sciences, the physical sciences, as its first behavioral science. So finally, we had someone, this Dr. Patrick, who said, it's time for us to do research on behavior, because behavior isn't just demons possessing you. It isn't just people who are just, we can understand, and there might be organic components to why people behave this way, and it could also be learned behavior. So psychology emerged in the 1870s, but this guy is often considered to be sort of like the father of speech pathology. Isn't it interesting that his name is Seashore, and Demosthenes was running over the I don't know how these things come about in history, but Seashore really wanted to understand better if hearing and speech were related. And at the time, there was no way to test hearing in an effective way. You may have seen or you may have observed something called tuning forks. Tuning forks were often used by musicians to calibrate their musical instruments as open instruments or to get the singer to hit the right note or things like that. But there was no way to use these in a scientific way to show that someone was not hearing properly. But Seashore invented the audiometer. And if you've ever had your hearing tested, you go into a soundproof booth and they send a little tone into your ear. And in audiology, you're taught to do this test. And the way that it's done is that you start at something called below your threshold where you can't hear, and we increase by 10 decibels until you say you can hear that, and then we decrease by 5 decibels, and we can get a printout of your hearing pattern that tells us that you're hearing in normal range, or that tells us that you're not hearing normally. And Seashore was the person who created that. He also became the first head of the very first department of psychology. And look at that! He became dean of the graduate school! Yes, yes, yes! So I just want to point that out. There's a natural progression. I just thought that was very cool. So, not only did he do all of these things, but he began to see that if we're going to study some of these things, we can't be isolated. And I think that's so interesting since we're trying to get more interdisciplinary study today. We can't be isolated. We're going to have to work with special education and physics and neurologists and all those kinds of things. So he got that, and he began interdisciplinary study through this Iowa Welfare Research Station. But this was a turning point. Sarah Stitchfield was her name at that time. A student. She was the very first, she did the very first modern day study of children's problems with speech. And later on, she married, and her name became Hawk. And she is one of the earliest presidents of the American Speech Language Hearing Association. I wrote down her year. I think that it's 1940. 1940. So she did her thesis around 1920. So about 20 years into her career, she was elected as president of the American Speech Language Hearing Association. One of the pioneering women who took on leadership roles that until that time primarily were only available to men. She was a pioneer in our field, and when the College of Sciences does their annual WISM, Women in Science and Math, Sarah Stitchfield Hawk is always featured as a woman of science who really laid some of the best groundwork in our field. Then, a colleague, Glenn Mary, established the very first speech clinic. This is the first time that we had something called a speech clinic. So, very powerful. And Mary became the president of the organization that preceded what is today the American Speech Language Hearing Association. So he's not ever considered a president of ASHA. He was a president of this National Association of Teachers of Speech. ASHA began in 1925. So the organizations that were before that were not considered part of it. And the very first quarterly journal, and I brought one with me today. I just think this is so quaint now. You know, we don't have these in print anymore, but this is one of the last print copies I received. And this is what the Quarterly Journal of Speech Education became, the Journal of Speech Language Hearing Research. And I'll talk more about this in a minute. We also had the first book, the Teacher's Book of Phonetics. I could not find a copy of that, but that book is actually the parent to this little book called the Voice and Articulation Drill Book. There is not an SLP in the world who doesn't own this little book. Everyone has to buy a copy when they're in an education program. It is still used today. It's on its, like, I don't know, 307th printing or something like that. Very important. It's by someone I'll name, by Fairbanks. But I wanted to point out to you that in the mid-20s, some of the first programs were established, and one of them was right here in Illinois at Northwestern, and then one of them in Madison, Wisconsin. So the birth of our profession really evolved out of the Midwest, Iowa, Illinois, and Wisconsin. To this day, we look to those states and those institutions for our professional guidance. Lee Travis came along. I didn't bring it with me, but Lee Travis published the Handbook of Speech Pathology and Audiology. It's about this thick. It's our Bible. Everybody has a copy of that also, and it's just too heavy for me to bring over. But he finally established the American Academy of Speech Correction, which is that's ASHA today. That's what ASHA is today. And I wanted to point out that Giles Gray, here in Illinois, publishes this Bases of Speech. This guy, his first name was Bring. He went through life as Bring Bringleson. Don't you think his parents were incredibly cruel? I mean, who would have thought to name someone that? But he really began the process, the same process that happened here at EIU, of separating the Department of Speech Science or Speech Pathology or Speech and Hearing out of speech departments. They went from psychology to speech, and then they broke out into speech pathology. So that's kind of the lineage of our. And here's this little book, originally published in 1939, and here's this one. I brought it with me, the Van Riper Bible. Van Riper. Van Riper was a famous man who stuttered, and he was at Kalamazoo and went to the speech and hearing clinic there. And he is considered to be the first person to establish research bases for the treatments, clinical treatments of stuttering. And in this book, I found all of his original work and treatments, which I'm going to just summarize here in a little bit. But Van Riper is a really important name. I want to point out Van Riper because those of you who might know our program in speech pathology here at Eastern today, the person who teaches stuttering disorders has taught for many years is Dr. Carl Dell. Carl Dell was a patient of Dr. Van Riper and then later became his student. And so we have a direct connection that went from Iowa to Kalamazoo to EIU on the issue of stuttering. Then I brought this with me also, the book there by Johnson, Brown, and Curtis in 1948. That was the first time our profession began to shake out in these different particular disorder areas, right in this book, right at Booth Library. Here it is, right here. The first time that that happened was in this book. And so now we organize ourselves into disorders in which people can't say their sounds correctly, articulation. People have difficulty reading tone, voice. People have difficulty with fluency, stuttering. Children have delayed speech development, meaning that by age 1, they're not saying their first words. And when they get to school, they don't have the sentence structures necessary to learn. Children have what we call these organic disorders of speech, cleft palate or cerebral palsy that results in their muscles not working correctly, and of course impaired hearing. First one to do this. Ike Brackett, 1960, establishes the Illinois Speech Language Hearing Association. Ike Brackett was the chair at SIU Carbondale. He was also responsible for bringing a guy named Herb Kettbaker to SIU Carbondale, one of the most famous speech-language pathologists. And prior to Ike Brackett going to Carbondale, the chair was Delight Morris. And if you've ever been on the campus at Carbondale, the library is named for Dr. Morris. And he was one of the most important people in the field during his years in Carbondale. From Ike, and I wanted to point out to you that Dr. Brackett was the first president of the Illinois Speech Language Hearing Association, and I don't know if I've got them all, but I think there are 1, 2, 3, 4, 5, 6 presidents of ISHA, as we lovingly call it, beginning with Dr. Wayne Thurman, and then Mary Ann Hanner, Gail Richard, Jill Nilsson, myself, and today Brenda Wilson is the incoming president. And there probably could be a couple more. I just didn't have it in my notes. So the fact that it began in Carbondale, but I wanted to remind everyone that Easterns played a big role in ISHA. So, 1952-53. I liked this year because I was born in 1953, so I thought it was an appropriate year to talk about what was going on in the world of speech pathology. There were 307,000 speech handicapped children who received services in our public schools. There were 3,700 members of ASHA. I'm going to show you a slide in a little bit on how many there are today. So this is about 59 years ago. 2,200 speech correction professionals across U.S. schools, 5,000 in all work settings, and we need 500 to 1,000 new professionals to maintain the workforce. And we've never caught up. We've never had enough professionals for the workforce in this particular field for a whole host of complicating reasons. This is Martha Black, is someone that I met about 35 years ago. She was the reigning guru of speech pathology in the state of Illinois. I don't even know who the person on the State Board of Education is right now in speech pathology. I'm so embarrassed to tell you that. I should have looked it up. I can't remember who it is. But she was our advocate on the State Board of Education, ensuring resources for providing services in our schools. So 1.1 million was being allocated at that time. 8,000 Illinois school children were receiving services. There were training courses at the University of Illinois, ISU Normal, Northwestern, and Augustana, but programs emerging right here at EIU, and thousands yet unserved, and that just goes on. But I wanted to point that out to you from Dr. Black's report from 1953. So here's how we fit in. Here's how EIU fits in. In 1948, Eastern Illinois University offered its very first course in speech correction. It was part of the Department of Speech, which included speech pathology, what we call today communication studies, and theater. They were all one big program. In 1951, we began offering a course of study that was aligned with state standards, kind of the first step in being able to graduate students who could practice in the field. In 1953, my favorite year, Dr. Wayne Thurman was named head of the speech pathology department. It was then located in the basement of Pemberton Hall. It's being renovated right now, in fact. Oddly enough, though, where the original speech and hearing clinic was located, it's being renovated. It was right there next to the what was the textbook rental services. And Dr. Thurman was hired at that time to bring this program up to speed, which he did. In 1964, he moved it to what used to be the old clinical services building, now gone, but it sat on the corner today where the theater wing of the Fine Arts building sits. It sat there for all those many years. That was very exciting because now we had a current facility. And in 1971, we were the third ASHA accredited program in Illinois, after Illinois and Illinois State University. So I've always been very proud of that, the third accredited program. And about 1995 or so, we celebrated how many years we've been accredited. It was a great function. Many of our students came back. And then in 2003, the program moved to its current facilities over there in South Campus. So today, here's where we are. 150,000 ASHA members, and you have to have a graduate degree to practice in our field. You have to have a master's degree from an accredited program, meeting current standards to practice in speech pathology, and you have to have a doctor of audiology to practice as an audiologist, or an AUD sometimes it's called. And we're still debating in our field the notion of a clinical doctorate in speech-language pathology, as you may have observed earlier, treating patients with autism, and we saw Tyndall Brandon on our campus earlier, treating all of our veterans with traumatic brain injuries who come back from their war service as young people. They want to work, they want to meet people and have a life. And if you have a terrible brain injury, that's tough to do, and speech pathology services will be critical to your ability to do that, and we need to know more about that. Today, this is our organizational structure. It's a little bit more fleshed out than the one you saw by Johnson earlier, but I wanted to find out. I wanted to come back and answer these questions. Is there any research evidence to prove today, after all these years since Demosthenes, that if you put pebbles in your mouth, you'll speak more fluently? Is there any evidence that if you recite verses while you speak on the shore, that you'll become more fluent or more articulate? Is there any information that we have, any research, that if you're in a discipline program, you can improve? So I did a little research to find out. And so I went back to our roots, looking at Van Riper, looking at Fairbanks. Remember, Van Riper, 1930, this is Fairbanks, 1939, Van Riper, probably about 42, something like that. There's no evidence that speaking with pebbles in your mouth will reduce your disfluency or improve your R. But we use something today in the field called DAF, Delayed Auditory Feedback. I don't know if any of you had this. If you want to experience it, go over and see Dr. Gail Richard, and she'll put you on our DAF machine at the clinic. But you would put headphones on, and you would talk, and then you'll hear your own speech delayed. Sometimes, you know, when you have a bad cell phone connection, it's kind of like this. We've researched this for almost 50 years. For those people who are disfluent and practice using this, they become fluent. It's a great tool to help a very disfluent patient experience a lot of fluency. It is not permanent. It's not a permanent effect. And I would relate the pebbles in the mouth to DAF. It distracts a disfluent person and allows them to experience fluency, and they need to have that experience. But it is only a distraction. It is not a clinical technique that allows for permanent fluency. So I'm going to relate the pebbles in the mouth to that. Fairbanks was one of the first people to say, look, if you can't say this sound, look at me, watch me, do this with your tongue, and began the process of using placements in the mouth to correctly produce sounds. Very highly effective. Also, highly effective if the person is old enough. Children don't produce R correctly in normal development until almost age 5. So we wouldn't work with children prior to age 5 on an R disorder or an L disorder. We might work on some other sounds earlier than that, but you have to have a certain maturity sometimes to produce R correctly. But for all of you who can produce R and L correctly, or those of you who know little children who can at a young age, thank your lucky stars, because it isn't given to all that they can do that on their own. So that's what we know about that. What about reciting verses? Well, Fairbanks says, yes, strong evidence that increasing breath support for speech and slowing your speech down increases fluency. And we still use that today. It is a highly researched effect. And Van Riper. Van Riper has developed, over his many years of study, a very structured program for fluency. It is called the Van Riper approach, and it is called structured fluency. And the way that it works is that someone who goes to talk, so if I go to say my name, and I go to say my name, and I go, my name is Bob, and I stutter, he would say, first thing is, identify that. What are you doing? What is that all about? The next thing is, what can we do if saying my name causes a lot of anxiety? What can we do to desensitize this? So you need to hear your name spoken many times, frequently, so that you get desensitized to it. Then when you go to make that disfluent, you would cancel, you would stop. And you would come back and try it in an easy onset to prevent the repetition from occurring. And then he also talks about pull-outs. So there's a very structured process for this. And it's very effective with many, many patients. But I always try to point out that for people who are chronically disfluent, disfluency is the kind of disorder that is, I don't know if I can, if this is a fair way to categorize it, but you're always at risk for being disfluent. And you can be controlled for extended periods, but sometimes you just simply have to stop all that control. A little bit like, and for those of you who speak all day in a second language, you get tired of that and you just want to speak in your first language for a while. You just had enough of so it really is a tool to allow you to maximize your fluency in those contexts in which that's important. And then this is the approach that modeling R increases accuracy, and that's a research evidence that's true. And our last, Demosthenes approach, does following a disciplined program of diction and gestures make you more fluent or make you more articulate? You read all the research in their banks? Absolutely. You have to practice to improve R production or any sound you can't produce correctly. And the way that we would do this, typically, would be to start off with a context in which you can maximize your success. So coming back to, if he said lake for rake, and we found that with guidance and structure, he could get a good rake that way, we'd have him practice a rake and a run and a rabbit and get it in that one place. Then we'd move on to a more difficult context, like very, where you have a sound before it and it makes it more complicated to say. And then we move on to put it at the end, like burr or anger. Then once we have it in all three positions of a word, we'd start embedding those words into little phrases, and then into sentences, and then into everyday speech. So that's how that would work. And the same thing with stuttering. So, Demosthenes of today, here they are. These are the people today that are asked to be in the public, but have severe speech and language disorders. Gabrielle Giffords, she was one of those people that was completely normal until someone shot her in the head. And if you saw her say the Pledge of Allegiance, I believe it was the Pledge of Allegiance at the opening of the Democratic National Convention, you know, that took all of her speech pathology therapy to be able to say that, and she struggled only with indivisible, was that the word? She struggled with one word, and every time you go to a multi-syllabic word, that's always a challenge. But she has had intense therapy to overcome her traumatic TBI, traumatic brain injury. Barbara Walters, you know, she gets a bad rap, but she was in therapy for many years as an adult to produce R. That persnickety little R. She struggled with R, she struggled with L. And today, even though we still make fun of her speech, she's perfectly articulate. But she's a good example of someone in the public eye who was carefully monitored. Kirk Douglas, the father of Michael Douglas, had a stroke, about 6 or 7 years ago. And an actor, what do actors do? They use speech to act. He had intense speech therapy out in Arizona. And if you saw him recently on maybe the Academy Awards, his speech has returned miraculously, but he has some facial paralysis, which provides some mild articulation disorders. But he is able to access the language that he needs. We talked about Julie Andrews. Has anyone had a more beautiful voice? Got singer's nodules, agreed to in a surgery. She'll never sing like she sang in the Sound of Music again. She can sing at a low level, at a low tone, but she's lost that range that she once had, and it was a great loss for her. I happened to have an opportunity to meet her, and she talked a little bit about the loss of this particular area. Mary Macklin, very famous actress with a hearing disorder. She had a lot of speech therapy to be able to speak fluently because of the extent of her hearing impairment. She's also a fluent signer, so she often uses sign and other tools for speech. We just saw Temple Grandin, a person who was diagnosed with autism, who has all of the speech and language characteristics of autism that come along. Severely delayed onset of speech. She said she didn't talk till she was, I want to say, 3. A difficulty I could understand but couldn't get out the words typical with autism. And I know that all of us pick up all day long on the social cues of language. So if we meet, I say hi, you know right away to say hi back. You know how to take these turns. She talked about, I didn't know I was supposed to take turns until I played a board game. That's very common with speech and language deficits. And King George, all in the news because he was a famous stutterer, and you didn't really get to see King George per se, but you got to see someone playing him on TV, in the movie and get a sense of what that was like. So that's my story, and I'm sticking to it.
Well, any questions?
I have one.
Is there any relationship between autism and different language like German, French, Arabic, Persian? Speaking those languages.
If you have autism, you have difficulty acquiring language, no matter what your original language might be. Keep in mind that language is a symbol system, and you have to make the connection, and this is the difficulty. The difficulty in autism is there is a disconnect between what I say, pen, and the object that it represents. It's as though if I held this up and said dog, you would know that that was wrong, but for people with autism, they do not make the natural connection between the symbol, the sounds that you say, and the objects that they represent. And keep in mind that the relationship between a noun and its label is the most concrete symbolism that we have. You can imagine then, there's a verb that goes with this thing, and that verb is write, so you've got to learn that. There are adjectives that go with this thing. This particular one is silver, and is a cross pin. So you have to learn all of those symbols about everything in your world, and that's the breakdown. And so you can imagine the frustration when the person doesn't recognize the relationship, no matter what the language might be. For you, who speaks multiple languages, you have learned the symbol system for this object in more than one language. That, as you well know, we have been studying this for many years. It is easier for children to acquire multiple labels like that from birth through about 7 or 8 than it is for adults, which is why learning a second language in that particular period of time is a better period of time than later in life. Later in life, and we don't know the full reasons. Here's one great study that I always loved that was done in the field on sound production. If we had babies in here right now and we videotaped them, we'd learn that they babble and make sounds from across the spectrum of languages in the world. They don't just, if this was an American baby, they don't just babble American sounds. They babble sounds from across the world. But as they're exposed to English, they lose the ability to produce those sounds that are not part of the native language. They lose the ability to recognize that those are important symbols. Any of you who've then gone on to learn another language know how difficult it is if they have a sound that we don't use in English, and you've got to figure out how to master that, or you've got to learn how to master the different accent points to change word meanings, or in French you have to learn sort of the hypernasally business that they do there. these are interesting things about how languages work, and we always have to take them into consideration. So it was a long-winded story to say that autism is difficult for any language. And you heard Temple also say she was a visual learner. She saw the symbols that she needed were these concrete symbols. Pictures and objects were more concrete for her because language is so gone. Once I say it's gone versus a picture, that's there and you can see.
Other questions? Other questions? We will ask you to talk about Helen Keller in a very special occasion,
Helen Keller.
experience later on, but what would you tell us about Helen Keller's experience in 1 minute?
A great teacher. Having a severe hearing loss, which prevented you from learning language, requires intense, repeated therapy. And you heard Temple Grandin say this. You've got to have someone providing stimulation and services to you extensively all day long. And her family was wealthy enough to provide someone who could do that. Today, we train family members, teachers, significant people in the person's life to do that, because you've got to be stimulated repeatedly all day long to acquire the symbols necessary when you don't hear. And she had that, luckily for her. And you can see what a great mind was in there. What if we walked away from her? What if we walked away from Helen Keller and said, yeah, she can't. What if we walked away from Temple Grandin? In her generation, in the 50s, we walked away from many of those students. These are the key factors to such services for anyone who has a disability. Look at Stephen Hawking. I point out all the time, what if Stephen Hawking had gotten his disability as a 3-year-old and couldn't talk at all? Think of all that he brought to the world, and he hasn't been able to talk since like forever. So it's amazing that all that's in there, and finding ways to get it out. Of course, I think it's fascinating. I'm not sure certainly everybody else is, but I think it's fascinating trying to reach in there and pull it out. I'm so proud of Gabrielle Giffords. She's going to be speaking at our conference, our ASHA conference in November about her speech services, and it's in Atlanta in the week before Thanksgiving, the American Speech and Hearing Conference. And Gabrielle is going to talk about, and you may know people like this, to talk about waking up one day and you can talk, and then waking up however long ago it was and can't talk. And what do you do now? I know it was last year or the year before last, the English department brought in a symposia speaker. She was so amazing. I'm not going to be able to think of her name, but she was an English professor. I want to say I think she had a stroke, but I'm not sure that that's why she lost her language. But she lost all her ability to talk. And then with therapy, she got it back. She talked about what it was like to be someone who was a humanist, who studied and loved language. And now can't talk, so it was great therapy.
One quick question. The dilemma between, you said children can learn second language or more than a language until the age of 7.
Yes.
How would you balance this ability with certain, in Chinese they need to have certain articulation here, in Arabic, in English?
What we're looking for is exposure. They need exposure. That might not mean that they are fluent in that language, but we want to get them exposed to that language.
What I wanted to ask, the sense of security that you talk about at this age, when a child wants to say something he wants to express himself very quick, which language he would pick up if he has 2 or 3 languages? You always revert to mother tongue, something like that.
Boy, well,
That's a topic.
That's a long conversation regarding when children are exposed to multiple languages, which language they choose as the symbol, yes, for different things is interesting. That's very complicated. As you can imagine, I'm going to see if I can give you an example, because the symbols that you say are not just I'm not very attached to this particular pen per se, but a lot of the symbols that you say have a very deep emotional attachment. You're very connected to them on a different level. Your name, the names of the people that you love, certain objects in your life that are important to you are connected to you in a different way. So you could have terrible head injury or terrible stroke and still hang on to those words. Swear words are often very emotional and are often accessed in different ways. So sometimes after a stroke, that's all anyone can access, and so they let you know just how happy they are about things. But we access these words in complicated ways, and if certain words have certain emotional ties to them, a child might choose that word. And I'll give you an example from my childhood. I had Italian grandparents who came over on a boat. They didn't speak any English. They didn't want us to speak Italian because we were Americans. But when we went down there and spent, they lived around the block from me, I spent every day of my childhood there. One of my little jobs as a little boy for my grandma, because she liked having a clean house, was to go under the bed, behind the things, and get the little dust balls. She called those chapots. That's one of the few words I remember from my childhood that my grandma said. And to this day, I still refer to those little dust bunnies as chapots. And I think that that's a relationship that it was always a very fun thing for me to be doing in her home. It was a very kind of exciting, you know, I thought it was exciting, it was fun. And I guess because I was little and I could get down there and she thought it was so wonderful and she gave me, you know, rewards for doing it, I suppose. But I think that's how it's complicated in that particular way. I wanted to show you one more thing. I thought this was really cool. Just this week, I got ASHA Leader, our monthly magazine. Look at the top story, in search of stuttering's genetic code. So from 370 BC to 2012, we're still worrying about, what about stuttering? So anyway, I gotta stop here.
Pop, 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 pop.
You've rendered us all speechless. But it does give us some inkling of how you can manipulate so well the English language. And we would like to present you with
thank you.
the
Thank you very
certificate from our series, and thank you so
My
much
pleasure, my pleasure.
for teaching us today.
My pleasure. Thank you. Thank you.
Is he? Why you ask? Because anywhere I go, be it cats starting, be it technology, be it you name any symposia, any workshop, anything, he stands up and speaks very fluently and courteously. And one time I went to CAA, and guess what? He is presiding so courteously, so organized, and made things go very good. So I listened to the radio about an ad that says bop, 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 bop. It's all from accountants. And I came to know the man later on when I made my first study abroad course to Egypt. And he was a big supporter of the program. And it was one of the most successful ones, as I heard from others. Then that helped us to go to China after this. He was saying, Bob, without much ado, here's Bob.
Well, thank you very much. And thank you for coming out this morning. I send my accolades back to the both of you. Pathology was instrumental in raising awareness of the importance of study abroad and put down many barriers to ensure outside of Athens. And I went there a few years ago to visit with him. Unfortunately, we were not able to connect, but I'm hoping someday that he'll come back to campus and be able to be recognized for his contributions. So this morning, I'm going to talk to you about the beginning of speech pathology. And it all begins, according to legend, according to law, or according to fact, with Demosthenes. And you can see from this great picture of Demosthenes that not only was he a great speaker, but look at that flashy dresser. Look at those sandals. He was setting the stage long before this was really the standard. So I was really impressed with this picture of Demosthenes because I think it's always important to make a good first impression. So I thought we should start off by learning a few things about him so we can start to understand the context in which his sort of gave birth to speech-language pathology. And he had a tough life. While he was born into a very wealthy family, he was orphaned at 7. I could never find the conditions of his why he was orphaned. I don't know why his family died at that time. And so his father, who was wealthy, put all of his resources into the hands of 3 trusted individuals who betrayed Demosthenes and squandered his money. So when he became of age at 18, he was penniless and not too happy about it. All he had left was his father's estate. All the money, all the investments were gone. So he had a good reason to speak up for himself. Money can be a very driving force in people's lives, and it certainly was for him. And so he began a career at age 20 as a type of a lawyer, suing the guardians, Phobos, Demophon, and Euripides. I'm not sure if I've said those correctly, but he sued them, and to his credit, he was able to recover a portion of his father's wealth, and that allowed him to be able to live more independently. In this process, he moved toward becoming a politician and a lawyer. And of course, both of those particular careers are heavily based on your ability to speak, and to speak well. Recently, a big hit at the movies was The King's Speech. Can you imagine being asked to speak in front of hundreds of thousands of people and you can't speak fluently? Politicians and lawyers, professors are asked to do that all the time. Most people never that our students would have a chance not only to study in Egypt with someone who spoke the language and the culture, but also be part of the Three Gorges Dam in China, a great engineering feat in our world. And so I was delighted that EIU was a part of that. Dean Lanham, I gave an award 2 years ago now because in spite of the library being in 10 or 15 different places for 3 years, not one student ever didn't find what they needed to complete a thesis, complete a project, complete whatever they needed to do, not once in that period of time. I thought that was quite amazing, and I had a chance recently when I was doing this to kind of re-engage with the library, and I have to congratulate all the people who work here who make being a scholar something that's just a pleasure and enjoyable, and I really admire all of you for all of that. I had opened earlier with, I got this lovely email this morning from a student of mine from 1985, Athens of Philus. He was from Greece. He came here to get his master's degree in speech-language pathology. He was so excited that the university was focusing on his home country. So sorry he couldn't be here. And he is hugely successful. He is the director of a large craniofacial clinic in Greece, or give their ability to speak fluently or to speak correctly a second thought. But if you can't do it, it's a big deal. He has a very well-known oration called On the Crown, and this particular oration brought down several different governments, and I didn't have a chance to read it myself, but if you were ever interested, that's one of his greatest speeches. So that's a little bit about his background. So what was the issue with him? He had a mentor, like we all had mentors, called Pathology. There was a character called Mumbles, and I always use that as an example of indistinct speech, where someone like this, you can't quite understand what they're saying. Shortness of breath comes back to weakness of voice. Breaking and disjointed sentences. Stuttering is a little like that. It's broken and disjointed, and it calls lots of attention to the speech act itself, and therefore the message is lost. Now, it's more common, as you probably know, to do a W for R substitution and say wabbit for rabbit. And in fact, if you like the Big Bang Theory, there's a character on the Big Bang Theory that has a terrible W for R, W for L substitution. And he does it in a way that makes him very charming, but I guarantee you that if you